I'm Dr. Garima Bhambani, your faculty for PhD. Um, so let's start with the discussion of GT12. The first question which says is panel study is a type of. Okay. So now panel studies are a type of a longitudinal studies. Okay. What does panel study do? Panel study are a particular design. Okay, they are a type of longitudinal study. Okay, in which the unit of analysis is followed. So whatever your unit is, okay, it is followed at specific intervals for a long period. Okay, often many years. The individual is followed for a long time. Okay, now the key feature of the panel study is, okay, the feature of the panel study is that they collect repeated measurements. Okay, the subjects are measured repeatedly. Okay, repeated measurements are there. Okay, of the subjects and from the same sample. Okay, the group of people is the same. Okay, they are measured repeatedly at different times. Okay, so now a panel study, so that is the characteristic feature, because in a cohort study many times people drop out in between. Okay, but in a panel study what happens is the same subjects are followed for a long period of time and the subjects remain the same. Okay, so this allows the researchers to track the changes that have happened over time. Okay, and how certain variables they evolve. Okay, so this is a type of a panel study. Okay, now in which study it was found? So this is again, these are the studies from the classical studies on dental caries, right? So, in which study it was found that even with less oral hygiene, less carbohydrate consumption could cause less caries. Okay. Now, this was a study which was Hopewood House. What was in Hopewood House? This was a study which was done by whom? Harris. Okay. This study was done by Harris and Sullivan. Okay. This I've covered in the chapter Diet and Dental Caries. Okay. Harris and Sullivan. Okay. Now these were covered on, this is on children of 7 to 14 years of age. Now, what was Hopewood House basically? This was, so basically a millionaire had turned his house into an orphanage. Okay. So now what was happening is that these people in the orphanage, they were given a very restricted diet. Okay. So in this orphanage, people would take a diet which was very less in refined carbohydrate. Okay, and there was no meat which was given. Okay, so the water fluoride levels were also, the fluoride which was there in water, that was insignificant. Okay, and what was seen in the studies, the astonishing part is that the diet which was given is was less in carbohydrate. Okay, there was, the carbohydrate content was less in these people. Okay, and they were given a restricted diet, but there were orphans. Their oral hygiene was poor, basically. Okay, their oral hygiene was poor. There was no as such source of fluoride which was available to them. Okay, so the conclusion was that despite having a bad oral hygiene, despite not having any fluoride, they could still have very less amount of caries. Okay, like at the end of the study, 53% of the subjects were free from caries, and the mean DMFT of the 13-year-olds, okay, that was at 1.6. Okay, however, the corresponding figure for general population was 10.7. Okay, so basically this study said that if the diet is restricted, the caries can be prevented. Okay, so what you can see in the study is that even if the oral hygiene is compromised, okay, the because of the Spartan diet, the caries can be prevented. Okay, the next question is, in a developing country like India, which is densely populated, how will you prevent dental caries? So out of the options that you have, what is the way to prevent dental caries? The way out is that if the population is very large, and if it's a, a developing country, then the way to prevent is fluoridated water and salt fluoridation wherever possible. Okay, For water fluoridation, it is concluded that if the drinking water, okay, if for the water fluoridation to be effective, okay, if the drinking water is containing 1 ppm of fluoride, okay, and had a marked caries preventive action, and that controlled fluoridation of water is a practice. It's like if you administer fluoridated water, that is a very practical and effective public health measure. Okay, now if the country is densely populated, if you implement the community water fluoridation, that is a feasible method, okay, for the entire population, so that it is basically a public health measure, okay, which is where the entire public can be given the advantage, okay, or if you want to provide a widespread access to the fluoride, okay. So that is basically the answer here would be fluoridated water and salt fluoridation wherever possible. Okay. Scientific paper retraction. What do you understand by retraction of a paper? Okay. Retraction of a paper means that, as the name suggests, retraction. So this is basically the process of withdrawal, okay, of published article from the scientific journal. Okay. This is the process by which the article can be withdrawn from the journal. Okay. So basically a research paper retraction by an academic journal. Okay. If you retract the paper from the journal, okay, it sends a clear message that the validity of the paper has been brought into question. Okay. So the fellow researchers who may be citing that paper, or even worse, moving forward with the research, they have to revisit their research plan, which could lead to extensive loss of the time and effort. Okay. Okay, now this is a question which is calculation based. Now, in this study, there were 120 cases of lung cancer. Okay, so the total cases, as you can see, are 120. Okay, those who smoked, okay, out of these were 24 in number. Okay, and they, out of 120, 24 were smokers. Okay, so automatically we get the rest of the number. 1,000 cases were the people, 1,000 cases who did not have lung cancer, out of which 40 cases were smokers. Find the odds ratio for getting the lung cancer. What is odds ratio? Odds ratio is strength of the association. How strongly smoking is related to cancer. So we have the data, we have 120, we have 1,000, whatever is remaining would be this 96 and 960. Okay. Odds ratio is the strength of the association. So what is the formula of odds ratio? It is AD by BC. Okay. So this is AD by BC. So we'll multiply A into 960 divided by 96 into 40. So you will get 240 by 40. The answer would be 6. So we can say that there is a 6%, 6 times chance for the person to get cancer, okay, because of smoking. So from a case control study, we can derive what is like the case control study. From case control study, you can get what is called as the odds ratio, okay, which is measure of the strength of the association between risk factor and the outcome, how strongly the risk factor is associated with the outcome. Okay, next question. While planning for management, okay, this is your planning cycle. Okay, so you want to plan the management of a disease, we have to plan for strategy. Okay, evaluate the disease, reassess the planning, identify the missing step. Okay, so you designed your objectives here, you implemented the strategy, monitor the strategy that you had, and first is identify the problem. Identify what is the problem, then design how will you go about it, the aims and objectives, then implement the strategy, then monitor the strategy. Okay, then here is the step which is stop. Okay, this is the last step. So here the missing step is stop. Okay, now the purpose while planning is done is that why do you plan a program? Okay, the purpose is that whatever sources which are available, okay, are they matching with the problems that are there? Okay, You want to eliminate any expenditure, that is like you don't want any health resources to implement it to be wasted. Okay, you want to develop the best course of action so that you can attain that particular objective. Okay, that is another role for planning. Okay, the next question is that this is also the main planning cycle which was taught to you, which is first is formulate the health problems which are there. Okay, assign the priority. What are the health problems that you have? Then in them, what are the priorities? Okay, from the health problems, which problems do you want to focus on? Then, which is the priority problem? Then, what are the aims and objectives to implement? Then, from your aims and objectives, which is the objective that you want to give a priority to? Okay, then if this planning fails, what is the alternative program? Select the best program, combine the program and make an integrated plan. Plan the implementation, train the people who will run the program, orient them, initiate that program, start the data evaluation, collect the data, operate the program, and see if your results were satisfactory or not. Okay, that is one question. Next is sensitivity is defined as. What is sensitivity? Sensitivity is that you are able to, sensitivity is that to be able to, ability of a test. Okay, sensitivity is the ability of a test to identify correctly, okay, those who have the disease. Okay, those who have the disease. So basically sensitivity is that these are, the other word for sensitivity is true positive. Okay, like identify those who have the disease, which is true positive. Here you will say that the patient is sick and you have identified that he is sick, so the result has come out to be positive. Okay, that is sensitivity. So it means that if you say that there is 90% sensitivity, it means that 90% of the deceased people, okay, like 90% of the time when you have done the screening on the people who were actually deceased, you got a true positive, you got the result as positive, which was true, and the remaining 10% was false. Okay, so this is what we understand by sensitivity. Understood this? The next question is that the amount of time that has lapsed between the initial exposure, when the person is first exposed to disease, and its detection. Okay, the time that has lapsed between the two. Okay, what is that called as? So basically, that is the latent period. Okay, now what is latent period basically? Uh, so this is when the disease is, the infectious agent is already infected, but the disease has not yet appeared. Okay, so this is the pre-infectious period. Latent period is the period before the infection. Okay, pre-infectious period, and this is also called as the latency period. Okay, now this is the time interval between when an individual or host is infected by a pathogen and when that individual becomes infectious. Okay, that is capable of transmitting the pathogens to other susceptible individuals. Okay, so this would be the latent period. In biostatistics, the question number 9 is the same, that the null hypothesis is, the results are read as, the language is different, but the answer stays the same. Hence, we've put this question that the null hypothesis is rejected if p is less than 0.05. Okay, we reject the null hypothesis when p is less than or equal to the significant level. Okay, your data is favoring the alternative hypothesis, which suggests that there is an effect or there is an association in the population. Okay, there was a recently introduced digital platform, an app. Okay, what is that app? Okay, this was a digital platform. Okay, and this was an app which had list of all the dental facilities. Okay, so this app which was introduced, what is the name of that app? The name of that app is E-Dant Seva. Okay, when was this introduced? This was introduced on October 7, 2019. Okay. Now, this E-Dant Seva was launched by the Ministry of Health and Family Welfare. Okay. They launched the E-Dant Seva. Okay. And this is an initiative. Okay. This initiative was taken under NOHP, which is National. So the Ministry of Health and Family Welfare launched the E-Dant Seva under the National Oral Health Program. Okay, this is when E-Dant Seva was launched. Now, what was the aim of the E-Dant Seva? The aim is basically they wanted to sensitize that what is the importance. Okay, like uh, how is maintaining oral health important? Okay, so the importance of maintaining the oral health. Okay, this is what E-Dant Seva gave, and which is the nearest oral health care facility. Okay, which is the nearest oral health facility which is available. Okay, so this provides the oral health information collected from authentic scientific sources. Okay, the scientific sources provided this information, and what is the objective? That they wanted to improve the determinants. Okay, of the oral health. That is, we want to help people improve the oral hygiene, the healthy diet, and to reduce the disparity so that everyone can access it. So the purpose of this seva was that of this platform was that they emphasized the importance, which is the nearest healthcare facility which is available, and how oral health promotion and preventive services can integrate. Okay, so the aim was to promote public-private participation, okay, to achieve public health goods. Okay. Now, what is National Oral Health Program? Because many of you keep asking me that, ma'am, any program which is asked. So, what is National Health Program? National Health Program is basically in the year 2014. Okay. In the year 2014, NOHP was launched. Okay. NOHP was launched. It operated, now it had two components. What were they? One was a National Health Mission. Okay. Under this mission, okay, in the National Health Mission, the states and the union territories, okay, they seek permission to set up dental care units. Okay. What they do is these territories, they set up the units for dental care. Okay, where do they set them up? In the district hospital. Okay, they set up these units in the district hospital. Okay, and then there is a tertiary component. Okay, what is the tertiary component? So National Oral Health Program is, one is they're setting up the units in the district level hospital, and then the tertiary component is setting up the activities which are carried out in the central level. Okay, coming to the next question, the level of prevention, primary, secondary, tertiary are no longer used. Okay. Statement 1 says because it focuses on the disease of individual rather than on etiology. Risk factors among general population. Second, because there's an overlap and cannot distinguish when one level of prevention ends and the other starts. Here they are asking which statement is false, or which is, if any of this is false and other is true. So the correct answer is that both the statements are false. Okay. Coming to the next question, in epidemiological study, okay, the first case that comes to your notice, okay, what is that called as? The first case that comes to our notice is called as the index case. Okay, the first case that comes to the investigator is called as the index case. Okay, index case is basically, it might not be the first case of the disease, but the first case which has actually been taken in the epidemiological study will be called as the index case. Okay, an index case would be the first case which has been taken in the etiology. Okay. Now, health inequities in the country and outside world are. Okay. So basically, the health inequity. So these are the social determinants. Okay. So here, what they're trying to say is that the inequity, okay, the inequality in the country and the outside world, why are they? Okay, so they are because they are socially patterned. Okay, now there was a WHO commission which was on social determinants of health. Okay, this said that these are the various determinants of health. Okay, now there are socio-cultural determinants and there are social determinants. Okay, so it said that social determinants are the structural determinants. Okay, and these are the conditions of the daily life which are responsible for a major part of health inequities. Okay, they are like the WHO Commission said that the major reason for health inequities is because of the social determinants. Okay, so the determinants of health and health inequalities, that is the cause of the causes, are socially patterned, and this pattern may pass from one generation to the other. Okay, so basically not adequate attention is being given to the cause of the behaviors and what is the underlying social and environmental conditions that affect the behaviors. Okay, also environmental conditions also deserve attention. Okay, so basically there are various social determinants of health which can influence the health inequity. Okay, one is, what are the various determinants? The income of a person can play a role. Okay, how protected a person is. Education again is a social determinant. Okay, whether a person is employed. Okay, what is his job security level? Okay, what are his working life conditions? Okay, whether he is insecure about food. Okay, what are his housing facilities? Okay, what about his early childhood development? Then how included he feels when it comes to society. Okay, what are the structural conflicts that he's facing, and whether he has any access to affordable health services. Okay, all these are the social determinants. Okay, now which of these is true regarding the first quartile? Okay, first quartile means it includes 25% of the values. Okay, the lower quartile or the first quartile is the value which is 25% of the data points. Okay, now the interquartile range and the semi-quartile range give the idea of the dispersion. How much is it dispersed? Okay. Now what we need to remember is the lower quartile. Okay. The lower, this we've read in quartile. Okay. Location of percentile chapter biostatistics. First quartile is value under 25%. Okay. That is of data points which are found when you have arranged them in an increasing order. Okay, upper quartile, which is basically Q3. Okay, this is value under 75% of the points lie. Okay, when you put them in increasing order. Okay, and the median, that is the central value, is Q2. Okay, that is called as Q2. And what is the interquartile range? The difference between the upper and the lower. Okay, that is called as the interquartile range. Okay, so the semi-quartile interquartile range is half the interquartile range. Understood that? So this is the first quartile, second quartile, and the third quartile. Understood? So with this, we have finished off our GT 12.